Hey, it's Dr. Simran Dillon, specialist doctor and founder of Rockmelon. Welcome back to my channel. And today we have a really special guest. This is Dr. Simran Dillon. She's a specialist GP and a cosmetic doctor as well. And she's also my older sister.
She's my baby sister.
Sim, welcome to our channel.
Yeah, I'm glad to be here.
So we're here to help brown women, melanin-rich skinned women cut through all the misinformation, cut through all the crap and really understand their skin well, understand what the cosmetic industry is doing. And you've recently been to a really exciting conference.
Yes, I have.
Can you tell us a bit about what the conference was?
Yes, it's the non-surgical symposium. It's called NSS and It's held yearly here at the Gold Coast.
Yeah.
It's an excellent platform where all cosmetic doctors, nurses, nurse practitioners, plastic surgeons come on board, and we strive for excellent and ethical and evidence-based cosmetic practices.
Cool. Awesome. And there's been a big kind of change in how we've been doing cosmetic medicine in Australia over the last 2 years, but there's a huge update that's coming up in November this year, 2025. And we wanted to do a quick video and talk about these changes and talk about how it's going to affect our community, women seeking injectable treatments, and what the restrictions are on doctors, nurses, and practitioners. So let's get into it. I've got a few questions I want to ask you, Sim, because I was at a wedding, so I couldn't attend the NSS this year, but Dr. Sim did. And I think that we all need to know about these changes. So whether you're a nurse or a doctor, this is just our understanding of what's happening and the changes. Obviously, the main person or the main platform to go and check and verify all of this is TGA, Therapeutics Good Australia, and AHPRA, which is the medical board, which basically governs how we advertise and how we do things in this space. What are the changes? Can you just tell us briefly what's going on?
So just to clarify, I'm not an expert. I am still learning. So please take that into consideration.
Yeah.
But my understanding since, attending this conference and looking at the guidelines, I think the major changes centers around patient safety. That's the most important part. We are doctors and we are clinicians at the end of the day. We are trying to make sure cosmetic medicine is safe and effective for our patients. So that's actually the overriding principle when we practice any kind of medicine, and cosmetic medicine is not different to that. The latest regulations really target that. I think it's important to realize and not to be scared of it, because it is there to really make sure practitioners are practicing safe and effective cosmetic practices. And I think that's a good change. Having said that, there are certain things that we need to be very mindful of, because it is a big implications on us as practitioners to protect our registration, to expand our business. It is a fine balance. And I think that is very difficult to achieve sometimes and to understand everything. So the new regulation centers around S4 medications and so scripted items and advertising as well.
So when you're getting a treatment done and you're using medications to inject into someone's face, you need a script for certain drugs.
Yes.
Correct? So those drugs, previously, it was quite easy to obtain scripts and be able to administer those drugs effortlessly. And now they are much more controlled. And because this is for educational purposes, we are talking about anti-wrinkle medications. We're talking about hyaluronic acid fillers. And in November, we are no longer allowed to advertise this, but this is when you're directly talking about your service or your business.
You can't, I'll just cut you off, that you can't, when you're advertising, use such terms because they are S4 medications. This is what I understand.
Yeah.
So you cannot use terms like anti-wrinkle injections. You can't use or prelude to an S4 medication even in your advertising. Okay. This is very clear. You can only speak about that one-to-one with a patient in your room.
Right.
So please be very clear on that and be very mindful. When you are advertising, please think about the services you're providing.
Yeah.
So the examples, like terms that we can use, is minimizing fine wrinkles.
Fine lines and wrinkles.
Yeah. So we can say that we are treating fine lines and wrinkles.
And for like a customer or a patient, or, our community, that might mean that you no longer can actually search up whether a clinician does a particular injectable treatment. They will only now be able to have on their websites, on their Instagram pages, that they provide treatments for fine lines and wrinkles, but you don't know if that treatment is a certain modality necessarily.
Because it's alluding to the AHPRA medications. This is what I understand. So you can't advertise as a practitioner, you can't advertise or allude to an AHPRA medication. You can do that in a one-to-one setting though. But you just cannot advertise that. You cannot put that in your social media.
So once I book an appointment with a doctor or a nurse, I'm able to then in that consultation ask them, can I have this, or what do you recommend is my treatment modality for this fine line, this wrinkle, this cosmetic concern?
Yes.
And then it's, obviously fine. Talk about it.
You hit it on the nail. That's exactly what should happen. But your advertising needs to be very careful. And just on the note of doctors giving telehealth consults, also they're tightening on that significantly. So if you're a medical practitioner, we all hustle, we do side hustles. I know medical practitioners that will take telehealth jobs because that's like their side income.
So essentially what that means is like if with you or for you, you can be somewhere else and be able to talk about risks and benefits via a video consult or on the phone with the patient, and then the nurse can continue to go and do that injection. But now that's not the case.
Now it's changing.
From November.
So there is more implications on the actual doctor that does that. So you have to be very, very careful. What you need to do is, because you are directly responsible for that script and that treatment that the nurse is providing. So as doctors, you want to protect. Your registration means everything. And you want to protect that. So if you're doing interstate telehealth businesses as a side hustle, you need to be aware of the different regulations that are state-based. So Victoria has different ruling. New South Wales will have a different ruling. Queensland will have a different ruling.
My understanding in Queensland is that the clinician, the doctor, or the nurse practitioner, which they do extra training to become a nurse practitioner, who can prescribe medications, has to prescribe the medication to that particular patient. They have to be able to be responsible for where that medication is dispensed. It's stored so that it's stored correctly. Because you don't want things that are reconstituted just to sit outside and then you get botulism and complications. And they also need to be able to be on site to manage any complications.
Exactly.
But the nurses, registered nurses can still administer it.
Correct.
But they need to do a year of training now, which is also new.
Yeah, that's a new thing for the nurses. It's very relevant, no longer an option. It's fine if you've been doing it, so that's not retrospective. So please keep that in mind. So don't panic. The nurses who are already doing cosmetic injectables and treatments, they are fine. But coming up as of November, I believe, correct me if I'm wrong, you have to have 1 year of hospital training, accredited training, and then you are allowed to inject.
And this is for a registered nurse, not more junior like an enrolled nurse or an AIN.
An enrolled nurse can't do it. You can only work under direct supervision of an RN, of a registered nurse. So that's always been there. That has not changed, but the changes are the 1 year of training that you have to have in a hospital setting.
I see.
That's a non-negotiable now. And I think personally that's not a bad thing, because if you think about the risk and medical legally, that does make sense. So you get a bit more training. As doctors, we have to do internship 2 years.
Even as doctors, there's a lot of, like in the past, there's a lot of stories that you hear about practitioners who don't actually do any cosmetic medicine, but continue to script for cosmetic medications. And so now the restrictions, like according to our medical board, AHPRA, is that you need to actually have expertise within that field, but not even expertise, experience in that field, and have relevant up-to-date medical practice. So you need to be performing some of these procedures yourself to understand.
Exactly. That's what I mean. The doctors have to be so careful and so mindful who are doing the side businesses, who are actually not working as a cosmetic doctor. They are then taking full legal responsibility of these patients, the administration of this very serious medication. At the end of the day, they are medical procedures. And I think, like I said, the overarching principle here is patient safety. Please, as doctors, your registration is everything. So please protect it. Be very mindful on what kind of services you're engaging in. Please be aware of the ruling that applies. The other quick thing that I will mention, medical legally, you're not protected if it's not your field. So if, say, you are an intern.
It's not your special interest.
It's not your special interest. You then are giving telehealth services for scripting. Like Avent came on and spoke about this. They will not cover you.
So Avent's a medical indemnity insurance that's quite well known in Australia.
And the income that the nurse makes, that is the declarable income you have to then declare to Avent.
That's crazy.
So if you're doing, say, 200 scripts of cosmetic medicines, you are then legally and financially responsible for all these medications that are being administered.
And that has implications on tax, on...
Exactly. So
lots of things. Insurance.
I mean, your premiums, you know, what you're going to pay it's just not worth the risk. That's personally. Some people might be okay with a bit of risk, but please be mindful that you are taking on that risk when you are scripting that medication for that patient. And that income that they're giving the nurse, you may not earn that income because you're only getting your script money or your declarable income to, say, your medical legal defense organization has to include the treatment that the nurse is giving the patient. I was blown away when they were talking about this because I wasn't aware of this.
And that was specific to that medical indemnity insurer.
Correct. That is Avent.
May differ depending on the insurer, but I think that often when one big insurer does something, a lot of them follow suit. How do you think that this is going to impact on businesses?
I think it's a challenging time for businesses because you simply cannot advertise what products you have because they are S4 medications. Like we can't, advertise about antibiotics, and a similar ruling applies now to cosmetic medicines. But I don't think that's necessarily a bad thing. I think your chance as a business is to really, really impress your patient that comes to you. You really need to be a good practitioner. And the patient will see that. Overselling items is no longer allowed. So that's also another thing that you can get in trouble for now.
Which is, I think, really good for patients. Like, you don't want to be upsold and you don't want to be bought into things that you don't need. Like if you want a particular treatment, take it one step at a time. And, see the outcomes. You can obviously ask and be educated, but it's quite refreshing because I remember back in the day when you walked into, common laser clinics, you would be upsold treatments and you necessarily didn't need them. And for melanin-rich skin, some of them can be really, really dangerous and cause pigmentation, and even a needle to the skin, leaving a bruise, can cause long-term hyperpigmentation because even bruising, even hemosiderin, which is the breakdown product of blood, can cause pigmentation in us.
Yes, 100%. Yes, absolutely right. And that's, I think, the whole idea of it. I welcome these changes. I'm actually excited about it because for me, it only shows that if you're a good practitioner and you practice ethically, then you will already bound by most of these rules anyway. You never upsell because I'm a doctor. I'm there to treat patients' concerns, always at the start. But then has my job to do a treatment plan. That treatment plan is up to the patient. And you need to get financial consent in anything you do. And that has not changed. But do it in your one-to-one setting. So you can show quite openly whatever in terms of S4 medications that you have and above in your consulting setting. So your consultations will be more important than ever in all these changes. But for business to then advertise what you have and what you don't have is a challenge.
You cannot do that.
You cannot do that.
And you can't even do before and after photos anymore. And if anyone is doing before and after photos...
You can do them. You can do them, but you cannot write the S4 medication that's alluding to that kind of treatment.
Interesting, because my understanding was that you couldn't do them, in particular if it is showing that the result is likely from an S4 medication. So if someone has tiny lips and then has a huge lips after that, the only kind of treatment from a non-surgical setting is most likely going to be an injectable treatment.
I find that not having
a cosmetic medicine attached to it. You know what I mean?
Yes.
So what was the chat about that at NSS? What did they say?
They did mention that the lighting, so your before and afters can be done.
Oh,
They can be done
right.
in the same lighting, same clothing.
Wow.
No filters used.
Yep.
With a disclaimer for the patient at the bottom.
Yeah.
And individualized treatments, may vary in different patients. But if your before and afters are showing the best possible outcome and not realistic in your portrayal of your services, then that is seen as misleading and inappropriate advertising. That is a concern. It is almost making it impossible to do before and afters. It's not that you can't do it, but you just have to really, really hone in on the actual ruling surrounding this.
What about doing before and afters when it comes to the prescribed S4 cosmetic medicines?
You cannot say this was done by this medicine. No.
But you can put a before and after photo potentially. We'll need to check this.
Yeah.
But that shows a treatment being done. You just can't state what
So
that
you can
treatment is.
say these are the treatments we use to reduce fine lines and wrinkles.
Yeah.
And you can put a before and after. But then you cannot state this was done
This was
by a
neurotoxin,
certain
this was a
treatment.
hyaluronic
you
acid.
cannot do that.
Okay.
So because that's alluding to the medicines.
Right. And you can't then DM a clinic or DM someone and they tell you what that treatment was. It needs to be in a consultation room. And even pricing.
Correct.
Really cannot be
pricing.
advertised online, even when you're booking through like a hot doc or a booking system online. It's actually no longer allowed. So it's really quite hard for consumers, for my audience to understand that it's a lot harder to do things like price beating and price matching because that is not the focus of your own safety anymore. It's not about getting the best deal. It's about getting the most safest treatment.
But it is challenging for the patient then, because there are clinics that charge for consultations and they have to go in and then get a price list. So you can have a price list sitting in your medical office and you can give out a brochure, but that has to be in the consultation. It cannot be as an advertisement on your website, on your social media. You have to basically turn off any kind of comments or anything that might be alluding to a testimonial or pricing or anything like that. You have to turn it off and you can't be tagged.
Can you use influencers?
Good question. That's a very interesting question. So if you are paying an influencer, you are directly responsible as a clinician about what they are talking about. So if they are then talking about an S4 medication and you are directly employing this influencer, then you are directly responsible. So no, that same ruling applies.
Okay.
So it is very...
What if you're not paying the influencer?
They cannot tag you. So
right.
If it's a genuine review from a patient.
So like a layperson's just talking about their treatment, they're allowed to talk about S4 medications, but they cannot say, I got it at that clinic.
At that clinic and cannot be tagged. So if you are tagged and you are happily, saying, please leave us a review and tag us, you can't do that anymore. You cannot be tagged, even though you're not actually paying them.
Right.
You cannot be tagged as seen as promoting your business in that sense. So that is tricky. So just be careful. Turn off tagging. Personally, I think turn off the tags and turn off the comments. This is only for S4 medications, obviously.
So if you're doing a laser treatment,
it doesn't
apply because it's not an S4 drug.
Yes, but you cannot be, as a clinician, seen as advertising by that influencer.
Oh, with that influencer, right. Okay. So that's not just the TGA. This is AHPRA. AHPRA is the medical board, so they're not controlling the regulatory medication side of things. They're controlling what they think is good medical practice.
Correct.
Right?
And they can't see as you advertising that you are the best, like you are,
you are the expert or you are Australia's #1
leading practitioner.
Because there's no actual way to quantify that.
So that's AHPRA's cracking down on that as far as I understand. So it's very interesting.
My next question is, a lot of titles or names that we use to, label a cosmetic doctor, plastic surgeon, a cosmetic surgeon, cosmetic physician. Tell us a little bit about the nomenclature, the naming that they're cracking down on.
Okay, so doctors, please be careful. You can't use cosmetic surgeon because you're not. Say if you're a GP specializing then in cosmetic medicine, you are a cosmetic doctor. Do not call yourself a cosmetic surgeon. That is illegal. That you cannot do that.
Because you didn't attend a surgical fellowship college.
That's FRACS, like they're plastic surgeons. They've done so much training. With all due respect, I think that is really, really appropriate because they've done the extra training. They are plastic surgeons and we respect that. So we address them as the surgeons. But you as a GP, say like me, who is doing cosmetic medicine, I'm a cosmetic doctor. I'm not a cosmetic anything else. I'm not a surgeon. I'm not a specialist, in cosmetic. I have an interest in cosmetic medicine. And I'm a cosmetic doctor. But I am a specialist GP.
So you hold specialist registration in a college in Australia called the Royal Australasian College of General Practitioners.
Correct.
But you're not a physician, you're not a surgeon,
no.
You're a cosmetic doctor and a specialist general practitioner.
Correct.
So that's all kosher to use. But if people are using different terms and if you've got a question where that's
you can use things like cosmetic practitioner.
Because you're a healthcare practitioner.
Yes, correct. A nurse, an RN can't use a nurse practitioner because that's a nurse practitioner and additional qualification. So please be very mindful about using that kind of terminology. Yes, correct.
Awesome. Okay. Are there any specific benefits or consideration that women with melanin-rich skin should be aware of when choosing a practitioner under these guidelines?
So that means you just carry more pigment than anyone like the Fitzpatrick, like the lighter skin Fitzpatrick types. You are carrying a higher risk in terms of treatments that are out there. And if you are not sure about what treatments you should or should be getting, because post-inflammatory hyperpigmentation is a real risk. So our skin is designed different, especially brown skin. So I can speak ethnicity wise. Indian skin, we do tend to get more post-inflammatory hyperpigmentation.
Yes, that's what this channel is all about.
Yes.
Yeah, what would you tell a brown female patient in their 40s that come and sees you in your cosmetic clinic? What sort of things are you going to talk about with them under these new guidelines? Like what's important?
Look, there's so many aspects that are important. I think as cosmetic doctors, we tend to focus on the S4 medications because that's what we're there to provide. But personally, skincare, like you're doing, is amazing. And it's really, really part of your treatment because you've got so many layers of the skin, your epidermis, dermal, as clinicians, we can treat the dermal part. What about the epidermis? We want to get topical treatments in. So things like rock melon is amazing. It is not an S4 drug, so I can talk about rock melon. But essentially, even though it's not a scripted item, these are drugs that are important for the skin hydration, the skin health. Our job as a practitioner, especially in regards to brown skin women, one is to advise the risks with treatments with brown skin. The other important thing is skincare. And we tend to forget about skincare. And the most important thing, I think, is the holistic part of skin health. So that's what you eat, your diet, your exercise, producing natural collagen, staying hydrated, using good skincare like rock melon.
One product, multiple ingredients.
Exactly.
What sort of ingredients do you like using for your patients, or do you pre-treat your patients with anything? Do you get them to use hydroid creams? What sort of things do you do with your patients?
So with my patients, I target and look, first of all, what they need. Is hydration what they need? And then you can talk about ingredients like hyaluronic acid. That's more in a topical form, or an injectable. I can't say that now because of the things, but hydration, skin hydration is really important. So let's look at what their problem areas are, and then I target accordingly. So brown skin's different, and the ingredients you have in your product, I think, is amazing because they treat different parts of the issue. Every patient will differ, and brown skin women especially will have different issues, like you have alluded in your previous videos, and the problems that it can come about. So please check out the videos. I think they're very good and and informative, especially for brown skin people. And our skin is different. So we do have to treat it differently, but looking at the issues that you individually have. The good thing about certain skincare products, they do have a lot of that ingredients in one treatment that makes it easier for then having part of your routine. Other important thing is consistency and routine.
Yeah.
Your entire lifestyle will show on your skin, basically, isn't it? When we talk about skin health, whether you're a smoker, whether you drink alcohol, whether
and how
you
many years
hydrate.
have you been a GP for, and you've seen the whole spectrum of
I've been a GP
skincare
for
issues?
10 years now.
Yes.
And I do skin cancer medicine.
I think you've been a GP for 10 years, but you've been a doctor for
15 years.
15 years.
Yes.
And you did lots of women's health in particular.
Yeah.
What sort of tips do you have for our audience from a lifestyle perspective that they should try to adopt on a daily basis?
If you want to have good skin forever, and that's a possibility.
Yes, we do.
I mean, we all, as women, we strive for looking the best we can. I think that's the most important thing. And that will be different for everyone else. But the lifestyle, the entire life that you do will show on your skin. And that's so important. So that's hydration, eating your greens, having a good diet, hydrating up to 3 liters a day. It's the basics of skincare, doing regular exercise, producing your natural collagen, protecting your skin layer. So that's with good skincare routines, really looking after sunscreen. So important. Sunscreen.
The most important, particularly for us,
important.
melanin people.
Yes.
Even though traditionally we didn't think it was needed, it is so important for hyperpigmentation and melasma.
Yeah, so sun protection, using good skincare that protects the skin, hydrating well. So inside out skincare I talk about, inside out skin health, and outside in. So make sure your lifestyle habits,
I like that.
Smoking, drinking alcohol, just things that really dehydrate. A lot of caffeine. I'm guilty of that, mother of 3 and trying to do it all. That's my drug of choice, caffeine. We all have our vices, but then how do we minimize that impact on our skin health and to really protect our skin?
So every cup of coffee you drink, you need to drink at least 2 to 3 glasses of water because you're going to pee all of that volume. So those are the things that,
and I tell my patients, you know what your biggest organ in your body is?
Your skin.
Your skin. So basically, you have to protect what's protecting you from the outside. And that's doing everything from the inside out, yourself, and what you're putting outside in. So it's the holistic approach.
I love that concept. Inside out, outside in.
Yes.
Let's
it's
focus
a
on that.
holistic approach to skin health.
And then mental health is a whole other ballgame of cortisol and how it affects your skin, and then your gut health and those sorts of things, which you must be doing on a day-to-day level with your patients.
Yes, 100%. I mean,
chronic health problems and how they affect skin.
Exactly. I see a lot of perimenopausal, menopausal women. And how the hormonal changes affect your skin, your mood. It's absolutely a whole area. And I'm going to be honing and focusing in my clinical practice on these poor women that really suffer these issues.
What's the biggest issue that they suffer? Like, what's the thing that, I haven't hit perimenopause yet, thankfully. What are the struggles that you're seeing and how are you helping them?
So the problem with menopause is that it's perimenopause and it comes on even when your hormonal levels are starting to decline. The thing with menopause, it just hits you. And I see patients at that level. They come in and they're like, Dr. Dillon, like my moods are all over the place. I'm a different human being. And my skin's really dry. I'm dry down below. I hate everyone. And it just happens to them. Terrible. And it's actually cruel. But the thing is, definitely see your doctor and talk about it. Menopause and medicine is another area of medicine which I'm very interested in, by the way, because these women do suffer.
Yes. And seeing like practitioners whose sub-interest in menopausal medicine is so important, because there are so many times that patients have come and seen me and say, no one cares. No one wants to even listen about my issues regarding women's health and menopause. And obviously this is a common issue within women's health itself, but finding a practitioner that actually does deal with that on a regular basis.
Yes.
Who knows?
And I think we underdo it as doctors personally.
Yes.
I think there's not many doctors out there that know much about menopause because it's a different ball game altogether. We know the hormonal pathways and things, but the treatments available out there, women do not have to suffer.
Yeah.
And that's really important.
Women don't have to suffer in silence. And
Correct.
if the practitioner isn't the right one giving you the right options, find someone else.
Yes, very important. Yes.
Cool. Oh, I had one more question. Do you think these regulations are going to increase medical tourism?
Yes. The short answer to that is yes. Unfortunately, that's the reality of things because patients now can't go and access the price list. They have no idea what they're dealing with. It's so much easier for them to go online. It's not regulated by AHPRA or TGA because it's not in Australia. So they go to Turkey, which is a very popular destination.
Yes.
You know, Korea, Thailand, like all these places that do offer medical tourism, and they offer it very well, market it very well. And patients think that this is completely safe. Unfortunately, it's not the case, but you know, we see the end product of that, and please be mindful. Please be mindful of medical
and the
tourism.
complications, unfortunately, you just can't seek the care as instantly if you're on a long flight, particularly because we're down under in Australia. The risk of even that flight trip could be catastrophic.
Exactly.
You get a vascular occlusion, you're going up in terms of your atmospheric pressure, that can go and embolize and cause all sorts of problems, even just with a basic hyaluronic acid medicine, injectable medicine. Yeah. So hard. I don't even know what I can say anymore.
So this is educational. That's the other thing.
Yes. We're not going to be like, go and buy this from us now.
Yeah. We are here to educate. We're not, doing anything for other than that.
I wish I had someone to explain this to me. And why not hear it from other brown women?
Yeah.
Thank you so much, Dr. Simran Dillon. You have been a wealth of knowledge, and it's been so good to hear from someone in the industry that's just been to the most recent event, updating all of us cosmetic doctors, nurses, and also our viewers and our patients who are going to be noticing these changes. Now, at least we can understand where they're coming from. Patient safety first, because things do go wrong. And comment below if you want any different videos, if you want me to get her on again. She lives interstate and she's going home today, so I'm really sad. She's my best friend, sister, and my mentor for life. I think I've talked about you in other videos, particularly my failing the UMAT video and getting into medicine. So this is the sister that I refer to. And go check out my TikTok. She does some funny dances too.
We'll be doing more dances.
Yeah. All right. Love you guys.